Thank you.
Thank you, ma'am. Thank you.
Everyone, happy to see that Hindi session is daily progressing. Thank you so much, all the participants. And now it is the time for the English session.
Thank you, ma'am.
Welcome everyone for the English session. And good evening and welcome once again. We'll start our webinar with a silent prayer. Thank you. Thank you, each and everyone, for your participation and enthusiasm. And now it is our 1026th day. Continuously, we are conducting this webinar without any break. All the participants are our pillars for conducting this session. Thank you once again. And today's our guest is NIKUNJ Trivedi. He started his career as a medically qualified homeopath. He is a rank holder, and he started his career in 1980 in India and 2004 in UK. Now Amar Trivedi and his wife Amita Trivedi are licensed practitioner of UK, and they are running an infertility clinic. And he is specialist in treating infertility problems, and he is the author of 4 books in infertility. And he's he had done fellowship in British Institute of Homeopathy and rewarded as a man of achievement in 2002. And he's the board member of Children Charity in UK. And published many articles and research papers and treated 200,000 patients.
थाली में वहाँ पर भिंडी रखा है, लेके आओ स्लैब पर.
Sorry for the disturbances. And currently serving chairman of UK HMA, and he is the member of Indian IHMA, and now he's a leading practitioner of UK. He's running his busy clinic there. Dr. NIKUNJ Trivedi, you're welcome. Doctor, please.
Yeah. Yes, good evening, everyone. Yeah, I'm very much delighted to share my thoughts on the sleep disorders and homeopathy. And hope you will enjoy my small presentation on the sleep disorders and how homeopathy is changing the lifestyle of the person, of the patient. Okay, we are going to talk on basic fundamentals of the sleep, because 1 hour is not sufficient time for me to describe all the sleep disorders. So just we will have only glimpses of the sleep disorder. But before we start, let us go to some basic of the sleeps. Sleep is a part of our day-to-day routine life. As we all know that we cannot live without food, we cannot live without water, we cannot live without oxygen. Same way, we cannot live without sleep. So sleep is an essential part of our life. And sleep bears importance from the childhood. As soon as child born, child sleeps. And newborn child is sleeping at least for 16 to 18 hours. And as the age advances, it is reversing. So with the old age, the old person is getting only 5 hours sleep. So with the advancement of the age, it reverses. Living organism goes to sleep in their routine, but the non-living organism around us, they are also going into the sleep. You must have experienced that your laptop is going to the hibernation. it goes to the sleep. Your iPhone, if you are not using it, goes into the sleep. As a student, when we were attending the lectures, we used to go to the sleep. When lecturer was boring, I'm very frank with you. And the sleep is a sort of a process of anabolic activities to our whole system, to our mind, to our body, to our all the system. So sleep is very, very vital and important part of our body. Hibernation. Mammals, they goes into the hibernation, especially in winter. Another condition that is called the torpor. That is also decreased physiological activities. And another is estivation. It happens during summer. But we, as a homeopath, when we take the history of the patient, we always ask for sleep, we always ask for the dreams, and we always ask for sleep-related concomitants. And here I would like to take an opportunity to share my screen with you. So now our presentation begins. Are you able to see the screen?
Yes. എല്ലാവർക്കും സുഖമാണ്.
Yeah, because it's greetings from the RT clinic to all homeopaths, those who are attending my talk. So sleep is a good, it is bad, it is ugly, and it is dangerous. When we are getting a good normal sleep of 7 to 8 hours, maybe 9 hours on Sunday, it's good. If you get a normal sleep, it's good. Bad, if you don't get sleep, it's bad thing. Ugly means when you drooling of the saliva from the corner of mouth, when you get restless legs, when you get cramps in your legs, when patient is grinding the teeth, when patient is getting a night terror or horrible dreams, and when patient walks during sleep. It's ugly. And what is dangerous sleep? Dangerous sleep means if patient is talking during sleep, and when patient is revealing some secret of his or her past life, because I remember one patient, the couple came to me for a treatment of infertility, and the complaint of lady, the male patient was complaining that she is quite frigid, she is not responding me. And I said, why it's happening to you? And lady said that he is talking during sleep. Then I said, what it makes difference to you if he's talking? Then she said that he is talking about his girlfriend in the past. That what he had a girlfriend. Right now I'm married to her and she's talking all about her and he's praising. So that was making her to feel frigid. And that's why their relationship was not as normal as like other couple. So this is dangerous thing. Another dangerous thing is with the sleep, when patient becomes somnambulist, means walking during sleep. And if you remember in 1997, there was a one TV movie came, Sleepwalker Killing. The name of the movie was Sleepwalker Killing, and especially on the English channel, and the Mystery of Unsolved Files or Files of Unsolved Mystery. I don't remember exact that series, but File of Unsolved Mystery. That was the name of the TV serial. And it was based on true story. A man who was sleepwalking when he unknowingly killed or murdered his own mother-in-law. So this is a dangerous sleep. Somnambulist, sleepwalking, and so many sleepwalking news, so many sleepwalking issue made headlines in the newspaper. And many times during sleep, patient does murder, patient does theft, like that. So that's why it is called a dangerous sleep. So definition of the sleep. Sleep is a state of reduced mental and physical activity in which consciousness is altered and sensory activity is inhibited to a certain extent. During sleep, most of our body system are in anabolic state. Anabolic means synthesis, regenerating, like our immune system, nervous system, skeletal system, muscular system. During sleep hours, they shows the anabolic activity. All these are the vital process that maintains our mood, our memory, and cognitive function, which helps in endocrine functions as well. I'm sure that everybody must have experienced the sleeplessness before the exam. That is obvious because of the stress of the exam. It happens, sleeplessness. So sleeplessness is a conditional thing. And sometimes it's a medical thing we discuss later. But here the definition of sleep is a state of reduced mental and physical activity in which consciousness is altered and sensory activity is inhibited. To a certain extent, not to full extent, to a certain extent. So another way of describing the sleep, that state of consciousness that differs from alert wakefulness by loss of critical reactivity to event in the environment with a profound alteration in the function of the brain. Dr. Hahnemann, when he wrote Organon, he mentioned about the concept of individualization. So sleep is not a uniform phenomenon. It varies greatly in nature and depth from time to time, from person to person. If I'm getting 8 hours of sleep, one of my family member, he or she get only 6 hours of sleep and he or she feels fresh. So it's a concept of individualization and it varies from person to person. And organs like kidney, heart, lungs, gastrointestinal tract, they remain active during sleep. They are doing their own work. Brain is taking enough amount of rest. So now coming to the types of sleep. We got 2 types of sleep. And red eye movement stage, that is called the parrot sleep, or rhombocephalic sleep, and center of this sleep is pons, worm-shaped organ at the base of it is pons corollae. So center is in the pons, situated in the pons. And what happens to REM sleep? REM sleep means rapid eye movement stage. It always associated with the dreams of nightmares. Brainwave in EEG electroencephalogram
Sir,
Hello, can you hear me?
yeah, now, now I
Okay.
can.
Yeah, because in between the connection has lost, and
Yeah.
I'm sorry for that. That why it has happened, I don't know. But let me share my screen again. Okay, can you see
Yes,
the
yes.
screen again?
Yeah,
Yeah. So we were on type of slips. There are two type of slips that what I have explained you, and that what we were. Just a slide show. And yes. Okay, can you see this slide?
yes, yes.
Okay, thank you. Yes, we were talking about the EEG, the fast brain waves in EEG. Rolling eye movement is always present, loss of muscle tone, and patient is talking during sleep. Bruxism, that is grinding of the teeth. And suspension of homeostasis, that is called the Milu interior. Well, what happens with the non-rapid eye movement stage or non-rapid eye movement sleep? That is center of non-rapid eye movement sleep is in the brainstem. There is a fall in blood pressure, fall in body temperature, heart rate slows down, and brain uses less energy. So this is non-rapid eye movement stage of sleep. Now, coming to the sleep start. Sleep start means it is relating to the state immediately before falling asleep. Sleep starts are sudden, involuntary muscle contractions may experience when falling asleep. Can you hear?
Yes, sir.
Okay, but here something has gone wrong with this slideshow. Okay, so let me bring a shot of another Wi-Fi booster. Just a minute. So in Aconite, you'll find that sleep starts in sleep. Means patient jerks during sleep. As soon as patient falls into the sleep, patient jerks. Patient develop a jerking movement, and that is called the sleep start. And another name of this sleep start is hypnic or hypnagogic sleep. It describes the transition between
Excuse me, sir. Hello.
hello.
Okay. Now you can talk. I think in between there is a. Some network problem, sir. No
Yeah,
problem.
yeah.
Continue. Now it's moving, right?
Not sure the way it should move the way.
Yeah.
Sir, please stop sharing and then reshare, sir.
That's what I'm doing, because right now the whole
Sir, it's moving now.
Hopefully, I'm trying. But slideshow is not working. I don't know why. Okay.
So we'll select one by one. Otherwise,
Yeah. That is the only option which has left
yeah.
with me. Right. Okay. So we'll do that because slideshow is not working. I don't know why it has happened. It has never happened before. Okay, so according to me, sleep and snoring, they are made for each other, and sleep and dreams, they are also made for each other. That's what I assume, I have observed, and I believe. Have you ever seen any person snoring without sleep? You have seen many people snoring during sleep, but not a single person is snoring without sleep and awake. So same way, the sleep and dreams. Daydreaming is a different condition, but sleep is always associated with the dreams in many patients. Now, causes of sleep. So there are several theories for getting sleep. That is, one is cerebral ischemia. No, it's not working. Cerebral ischemia, that due to cortical ischemia, the drowsiness after food, everybody must have experienced this sensation that after having a heavy meal, good meal, sweets, fried food, we feel a bit drowsy. That is because of the splanchnic vasodilatation, which is causing fall of blood pressure, and consequent cerebral ischemia happens, so we feel a bit drowsy with that, and that brings a good sleep. Another theory is a Pavlov's theory, but it has not been accepted. Acetylcholine theory. In acetylcholine theory, there is an accumulation of acetylcholine in the cerebral cortex, and which brings the sleep. Another theory is a lactic acid theory, that is accumulation of lactic acid in the tissue causing fatigue, and then we feel sleepy. But that has not been accepted. Another theory is a hypnotoxin. Hypnotoxin liberated from the brain tissue, which produces sleep. But this theory is also not been accepted. And Brom hormone liberated from the pituitary. So still it's a sort of a question mark that whether this theory is still be accepted by the scientific ways or not. Still it's a question mark. So now let us coming to the physiological changes during sleep. So considering the cardiovascular system or circulatory system, what happens during sleep? Our pulse rate reduces, our cardiac output gets reduced, vasomotor tone gets reduced, and blood pressure falls or blood pressure reduced. What happens with the respiratory system? Tidal volume in the lungs, it gets lowered, rate of respiration gets lowered, and pulmonary ventilation also gets lowered. Our BMR reduced by 10 to 15%. Secretion like salivary secretion and lacrimal secretion gets reduced. But we'll take on constitutional basis that where the salivation increases and what are the causes for that. So gastric secretions remain unaltered. The acid secretion always remain unaltered because of the process of digestion of the food, or sometimes it has been raised, the sweat raised, especially those patients having a diabetes, and they are developing a sort of a hypoglycemia. They're having a profuse sweating during sleep at night. Muscle becomes relaxed. In terms of urine, volume is less during sleep, specific gravity and phosphate gets raised, and blood volume increased, and plasma gets diluted. What happens in the brain? Brain using less energy during non-rapid eye movement stage. Sleep increases sensory threshold, means sleeping person perceive fewer stimuli. So if anybody is in sleep and if you tickle, they respond, but the response will be not as quick as during awakening stage. And GABA, that is called the gamma aminobutyric acid, is always associated with sleep, muscle relaxation, and it brings a sedation. Other hormones, other neurotransmitter is also playing a very vital role, like acetylcholine, histamine, adrenaline, cortisol, and serotonin. They are very, very important for bringing the sleep and awakening cycle. So type of sleep disorder, this is very, very important because we are going to treat sleep disorder. There are many types of sleep disorder. They can affect health and quality of life. And if the disorder persists for a longer time, then definitely it needs a sort of a medical attention. So what are the sleep disorder? Insomnia means lack of sleep. Hypersomnia means patient sleeps a lot. Sleep apnea means patient stops breathing during sleep. And there are three types of sleep apnea. One is Pickwickian syndrome, that is called the obstructive sleep apnea. One is central sleep apnea, and third one is mixed sleep apnea. Then sleepwalking, that is called the somnambulism. Bedwetting, nocturnal enuresis. It happens in a children when small children having a sort of a worms, especially Enterobius vermicularis. It gets multiplied, it gets collected at the internal urethral meatus, and then it crawls over there, and then patient feels tickling sensation and then losing the control over the sphincter. So this happens with the children. But with the advancement of the age, when muscle becomes relaxed, when tone of muscle goes low, at that time, in a case of prostatic hypertrophy, in a diabetic neuropathy, in a sort of a Parkinson disease, or any other neurological condition, patient is losing control over the bladder, and that's why bedwetting happens. Now, coming to the parasomnia, that is nightmares, night terror, restless leg syndrome, snoring, and narcolepsy. So these are parasomnia. Parasomnia means patient is half sleep, half awaking. Okay, so now how much sleep do we need? It varies, as I explained you earlier, it varies with person to person. Newborn baby requires 16 to 18 hours of sleep. Children requires 12 to 16 hours of sleep. Adults 7 to 9. And with the old age, it's 5 hours. So when patient comes for a homeopathic treatment, patient always have tried the allopathic and conventional mode of treatment, and patient have taken lots of antidepressant, sedatives, hypnotics, and whatnot. That is called the SSRI. So benzodiazepine like triazolam, temazepam, flurazepam, amitriptyline, chlorohydrate, and meprobamate. But when all these medicines fails to restore the patient in a normal physiological state, at that time they try to seek the advice from the homeopath. And then right now, our main duty starts from here. Sleep disorders homeopathically. How we treat homeopathically. So as you know all very well that we having a miasm, sora, syphilis, psychosis, and tubercular. And we are considering patient as a whole. So we have to find the right miasm for the patient. Soric patient. What is soric sleep? Here it is. Soric sleep is unrefreshing sleep with dreams of fear and anxiety. Soric patient is always anxious. All complaints aggravated during sleep. And that's why if you remember lachesis, the sleep symptoms of lachesis is aggravation into sleep and sleep into aggravation. So this is a perfect rubric for the soric sleep. Sweating on forehead. Patient is always snoring. Patient having a lot of salivation. Patient is always grinding the teeth. That is called the bruxism. Patient becomes unconscious. Patient goes to the hypoglycemic coma, hypovolemic coma. Patient becomes unconscious. Passage of urine and stool during sleep. That is losing the control over the bladder. Twitching of the muscle during sleep. And penile erections always present in a soric patient. And this night, along with night discharge, we call the spermatoria. So considering all soric sleep symptoms, it reflects this is a rapid eye movement stage of the sleep. Now coming to the syphilitic sleep. Syphilitic patient is always rolling the head from side to side. Night sweat, having offensive smell. Syphilitic patient is also having a sort of a night sweat, but that night sweat having an offensive smell and aggravation from perspiration is a very common factor with the syphilitic sleep. So patient is unable to get good sleep at night because of the perspiration, because of the smell, and that's why patient is rolling head from side to side. Now psychotic sleep. Sleepless. Patient is sleepless because of the wandering pain. Damp cold weather is also aggravating condition. Thunderstorm is also a sort of aggravating condition to get the good sleep. Humid atmosphere, gouty diastasis, stiffness, soreness, inflammatory joint prevents to bring a good sleep to the psychotic patient. Psychotic patient also having a spermatoria and leukorrhea during sleep, and which smells like a fish brine. So this all about the psychotic sleep. And now lastly, we are coming to the tubercular sleep. Tubercular patient, considering the children and considering the adult, tubercular sleep is always coming up with the screaming during sleep, night terrors. Children cry out during sleep. During sleep, spermatoria and night falls happens, but without dreams, and auditory hallucination of different voices at night. And we are getting all these symptoms in our materia medica with different remedies. And with this basic physiology that what I have explained, with that, we can compare that patient is fit in which category, which medicine is right selection to cure his complaint of sleeplessness or hypersomnia. That I have just tried to explain with this small presentation. And now coming to the homeopathic remedy with the clinical significance. We having a more than 6,000 remedies, but which medicine is working on which type of patient, that's very important. So considering all this miasmatic approach of our patient, considering the history, considering the diathesis, considering the thermal reaction, if we repertorize and if we find the right remedy for treating the patient, then patient gets better very soon. And in my 43 years of clinical practice, the medicine which I have used in many of my patients with the good results that I have explained over here. And with that, we can go in a little bit of detail of the aconite. As I explained you, that is sleep starts, means hypnagogic sleep you will find with the aconite patient. Aconite patient always having nightmares, nightly raving, anxious dreams, sleeplessness with restless and tossing and turning. because of the anxiety, turmoil in brain. And whatever patient thinks during daytime, same thing is being reflected in his subconscious mind at night time. And that's why patient is getting sleeplessness, insomnia of the aged patient, those patients who are aged about 70 plus, and if they are complaining that they are not getting sleep, try aconite. Another medicine, which I have not mentioned over here, but I have got tremendous results with that, that is argentum nitricum. Sleepless from fancies before his imagination. Horrible dreams of snake. Dreams of snakes you will find in argentum nitricum, in lachesis, and in lac caninum. Dreams of snakes. But in argentum nitricum, dreams of snake is in different way. That is horrible dreams of snakes and of sexual gratification. That is in argentum nitricum. Now coming to the Avena sativa. Sleeplessness due to nervous exhaustion. Patient get nervous, patient get exhausted, patient having a sexual debility, and patient having a chorea, Parkinson, epilepsy, and whatnot. So any neurological condition, say for example, if you having a patient of Parkinson, and that patient having a sleeplessness, so despite of giving a constitutional remedy like Merck, Rustox, Zincum, neodymium dioxide, but on top of that, if you add Avena sativa in a form of mother tincture, 10 to 15 drops before going to bed, patient will have a very good control over the sphincter. Patient will not meet with an accident, or slowly patient will leave the wearing nappy or diaper. So this is that what I have seen in my clinical practice, and many of my patients has been benefited by adding Avena sativa with neurological condition. Now coming to the Baraita, talking in sleep. And as you know, that Baraita patient is having a NUI tedium, means patient gets bored very easily. Patient is absolutely indolent, lethargic. So this patient talks during sleep, awakens frequently, and feels too hot. And this patient having a twitching during sleep, twitching of the muscle, jerks in the muscle. Now coming to the belladonna. Belladonna is restless, as you know very well that belladonna is a remedy for the restlessness. Crying out, grinding of the teeth is present with the belladonna, screams out in sleep, and kept awake by pulsation of the blood vessel. Why? Because patient having a tendency to keep hand under the head. So that causing a pressure over the carotids, and carotid pulsation can be felt by the patient, and patient is losing the sleep. So this is what physiological observation with patient is getting good results. If you, because it's a sort of a uncontrollable phenomena that when patient is keeping the hand under the, this is very, very important. And pulsatilla patient is always keeping the hand over the abdomen. And belladonna patient is always keeping the head under the head. So this is the difference that we always ask the patient while taking the history. Borax, voluptuous dream. Patient a pleasurable dream, voluptuous dream, which tickles his subconscious state of mind. Cannot sleep on account of heat in head, and cries out of sleep as if frightened. The same thing is happening with the belladonna as well. Belladonna patient is also crying out during sleep. Now calibrom, this is very important medicine for the sleeplessness with restless patient. This patient having extreme drowsiness, night terrors, and this patient is also grinding teeth during sleep. Horrible dreams, and calibrom is a patient with a condition of somnambulism, night walking. Patient doesn't know that where he goes from one room to another. Sometimes patient goes out of the room. So calibrom is a very good medicine for the somnambulism. Now, creosotum. Creosotum, beechwood. And I remember, and I can correlate this remedy, because when we were students, we used to sleep on the bench because bench is made up from the beechwood. Sleep is always disturbed with tossing and turning. Paralytic sensation in limbs, and we call the sleep palsy. There are different types of other palsy as well, but the sleep palsy is very common with the creosotum. Anxious dreams of pursuit, fire, erections, etc. Now coming to the lichen. Lichen having a dreams of snake. Lachesis. Lachesis having a sleep into aggravation and aggravation into sleep. This is very important symptoms of the lachesis. Aggravation always throughout the day, very irritable. Sleepiness yet cannot sleep, and wide awake in the evening. Another thing, lachesis having a very important symptoms if we read in between the lines, if we understand the rubrics. So lachesis patient having all the complaints are better by discharge. So when patient, because I'm elaborating this thing, I'm treating infertility patients, and many patients comes with the sleeplessness. I advise them to have a relation, to have an intercourse, and male patient is getting good sleep at night because all the complaints are better by discharge. And this is very, very important rubric that I have perceived from the Mitra Medica and that I have applied to in my practice. Okay, now lactus, lactusa virosa. Lactusa virosa patient is restless, impossible to get sleep. And when patient gets sleep, patient goes to in a comatose condition. Now, urocirrhosis, spell of deep sleep with snoring and stertorous breathing, patient having a loud snoring. And why loud snoring happens? Because when patient or patient's relative, patient doesn't know that whether patient snores or not, but patient's relative, wife, or son, daughter, when they come along with the patient, at that time they give a history that patient having a loud snoring. My dad is snoring like anything, and it disturbs sleep because there is a nasal polyp. And with that nasal polyp, patient having a loud snoring. So if we give a remedy to reduce the size of the polyp, patient will stop snoring. And calcarea is the best remedy for the nasal polyp. Brahnia is the best remedy to reduce the size of the nasal polyp because Brahnia works excellently on all mucous membrane. Now, Madorinum. Dreams she is drinking. There are other three remedies having a dreams of drinking, and one is arsenic, another is phosphorus, and third one is Madorinum. What she is drinking? Either water, tea, coffee, milk, wine, alcohol, that I don't know. But dreams of drinking is always there with the Madorinum. And sleep in knee chest position, we call the genupectoral position. So position of sleep is also very, very important. And that also reflects the personality. So patient, Madorinum patient is always sleeping in a knee chest position, just like a cuddling. The way the fetus is being presented in embryo, the way patient sleeps. Mephitis, skunk. Awake at night with rush of blood to lower legs. Patient having some thumping sensation in lower legs. Vivid dreams of water, fire, etc. Netramure patient feels sleepy in the afternoon. Patient needs siesta and nervous jerking during sleep. That is netramure. Dreams of robbers. sleeplessness from grief, because you all know very well that Natramur is a medicine for the emotional type of personality, having a lot of suppression of emotions. And when patient is suppressing her emotions, so subconscious mind always reflect in some way or other, and the patient gives history. At that time, we can just find out that what are the cause for the suppressions. So this I have elaborated some important indications of our homeopathic remedies. List is very long. I'm not going to go in detail because we are approaching the time. And at last, sleep disorders are unable to describe in a span of 1 hour. It needs more time. And we need some another day, another session where we can explain all these clinical conditions with the sleep disorder in detail, and sleep apnea and parasomnia we'll discuss later. And if you're having any question, you feel free to ask me or email me, and I'll try my level best to give an answer of your queries, your question. And at last, thank you very much for listening me. I'm very sorry for the interruptions which has happened because of some network problem. And I try all the possible precautions, but after all, it's a technology. So accept my apology. And right now I'm summing up my session over here. Hope you have enjoyed that. Thank you very much. Thanks.
Thank you so much, sir. It's a great awareness for us. This is a wonderful session. And participants, if you have any questions, you can raise your hands and ask questions to Dr. NIKUNJ Trivedi. Now we have 10 minutes more to ask questions. Please. Dr. Shi.
Okay, anybody wants to ask any question? Or shall I? Yeah.
Beatrix. Okay.
Yes, Dr. Beatrix, how are you?
Thank you. I'm fine. Always a pleasure to listen to you. Dr. Nikuni, one question. Yeah. For me, there was a remedy which was new. That's called lactuca virosa.
Lactuca virosa, yeah.
Lactuca virosa. I did not know this. I just had a look in the Bördica. Could you explain a bit about that remedy according to the sleep conditions?
Yeah, more? Sure. Why not?
Yes.
Yes. I got your email address as well. So if you wish, I can just send you all the details through email, right? So yes, just go through that. But lactuca virosa is a remedy for the restlessness. Those who are moving here and there, means commuting, and there are a lot of things to do with the restlessness, and they are unable to get sleep at night. And once they go to the sleep, it's a comatose sleep. In Boric, you will have a very limited information about this, but I will send you through email. So you will have just go through that. It's a good medicine, but we are not using it frequently because many patients that don't have a comatose sleep like that. So they just go to the sleep. Yes, when patient having a hypoglycemia, patient sugar level goes down, at that time they sleep a lot. But
yes. So thank you very much. And just one more point. In my practice with the children, I have a lot of carcinosinum if they don't like to sleep. A lot of carcinosinum
is also working very nicely. Yeah.
Yes. With the children
we are also
especially.
Using,
Yes. You agree. But thank you very much, Dr. Trivedi.
No, you are more than welcome. Thank you very much.
Thank you.
Now, Mariam Salcedo.
Thank you very much. Today I don't have video. Sorry for that. Thank you very much, Dr. NIKUNJ. Your information was great. I want to congratulate you on this wonderful presentation because sleep disorders are a challenge for us. So please, can you explain me more about the indications for passiflora and if you have any experience with valerian?
Oh, passiflora is a wonderful remedy. I love to use passiflora in my practice. And passiflora is just like a muscle relaxant. When patient is in a pain, in cramps, we are giving a MACPOS to relax the muscle. We are giving a colocin to relax the muscle. Same way, the passiflora is relaxing the neurons. So if you give passiflora in a mother tincture, 10 to 15 drops in a cup of water, you will get amazing result with any patient, irrespective of any complaint. You can just play a blind game with the passiflora. It's lovely
great.
medicine. Yeah, I
And in
love
which
to use passiflora.
in which
And
potency did you use?
use mother tincture.
Okay, great.
Yeah, it has been mentioned in a boring that use 15 to 20, 30 drops in a cup of water or glass of water. It all depends. But passiflora should be used in a mother tincture only, not in a potency.
Okay, great. And did you have some experience with valerian in sleep disorders?
Yes, that also we are using, and it is also a very good remedy. But when patient is a short of a hypochondria, at that time valeriana will work like a magic. The patient is complaining the same thing again and again, and when GPS prescribed the patient to amitriptyline, means antidepressant, at that time, if you can use valeriana mother tincture or valeriana in potency, it will give a marvelous result. Yes, definitely.
Okay, thank you very much and congratulations. Very nice explanation.
Thank you.
Thank you very much.
Really appreciate your kind words.
Thank
Yes,
you.
Dr. Ganesh, how are you?
Thank you. Now, Dr. Danesh.
Dr. Ganesh is an encyclopedia. He's testing my knowledge. He knows everything.
Dr. Danesh, Dr. Anjana also raised hand. So we have 5 minutes, both of you share the time.
It's a very good presentation, sir, once again, and really, sleep is one of the things that will that give us an idea how to differentiate the medicines in between. Whenever you get this sleep as a characteristic or uncommon symptom as far as the patient is concerned, then we can go ahead with that particular symptom alone to prescribe. Yeah. So for example, when usually, as you know, the pulsatile patients always sleep very late, and they also very late in the morning. So in those cases, if the other symptoms are quite in favor of pulsatile, we can directly go with the pulsatile. Am I right, sir?
Yeah, pulsatile patient always keep hand like this.
Yes, as you rightly told,
Always.
that the patient always hold the head, hand on the head, as well as the children used to lie with mostly the pulsatile patients lie on abdomen during sleep.
And lying on abdomen is also giving another symptoms in a children. Dr. Beatrix, yes. I'm telling you this thing, sorry. Yes. But when patient is lying on the abdomen, small children, don't forget to give Sina or just to take a history of the worms, because when patient having a pain in abdomen, when patient is getting a funny sensation, then and then they will sleep on abdomen, because patients are better by pressure, and pressure comes on the abdomen, so patient feels better. So Sina, Centonine, Spigelia, these are the medicine which expels out the worms, and patient starts sleeping on the normal position.
Nice, thank you very much. Yes, welcome. Interesting.
Yes, Dr. Anjana.
Oh, Anjana, Dr. Anjana.
Yes, can you hear me, sir?
Yeah, sure.
Yeah, thank you very much for all the information you have provided so far. Just quickly, if you can throw some light on the sleep paralysis.
Sleep palsy, yes.
Yeah.
Sleep palsy is very common, because if you sleep in one position by giving a pressure or compression on the nerve, then it happens. Say, for example, if we are sitting like this, right? And the compression comes on the brachial plexus, it goes numb. Same way, it happens during sleep only, or for sitting in one posture for a longer time. When the nerve gets compressed, then and then patient is getting sleep palsy. Otherwise, no.
Okay.
And
if
sleep palsy automatically recovers by itself. Yes. And if it doesn't recover, then if you can just apply a shot of a cold water or hot water bag or anything, it requires a shot of establishment of the blood circulation. Yeah.
Okay. Thank you.
Welcome. Okay.
Thank you, Dr. Anjana. And anyone else? Actually, as soon as possible, you have to continue the sleep session again, because everyone is now only we entered into that interest. That time our time is
here in UK. When patient having a sleep problem, sleep disorder, and there is a sleep clinic, sleep foundation, and they are giving a sleep diary to maintain the sleep pattern, and the relatives and the close observer of the patient, they have to fill that diary. It's very, very interesting. When I come across a certain type of complicated patients having a lot of metrizapine and everything, and patient was not getting sleep, and I looked into the diary, it was a marvelous thing that how deep they are going. When conventional doctors, consultant, they are also doing a very good job.
Will the sleep pattern change?
Yes. We can change the sleep pattern. With the help of homeopathic medicine, we can also change the sleep pattern.
If we are not taking homeopathic medicine, normally our sleep pattern will change.
No. It all depends on your day-to-day activity. Say, for example, if you won a lottery of £1 million, you will lose your sleep immediately. It's a rush of the neurotransmitter to your brain. And if you will lose a £5, you will also lose your sleep, because that's a shock. So brain has to adjust with all the gamma aminobutyric acid, with the acetylcholine, with the serotonin. All the neurotransmitter is playing a very vital role in our brain. And that's why we have a sort of a circadian cycle. But today I'm not able to mention it because of the limitation of the time. And I don't want to take too long to explain all these details. Because
anyway, we are expecting
here is our boss, Dr. Dhanesh. He will immediately remind me that now you have to stop.
Okay, now it is the time for our Malayalam session.
Okay.
Thank you so much, sir.
Thank
It's a
you.
wonderful class, and we are eagerly waiting for your next class. And now I'm inviting Dr. Shaila for moderating Malayalam session. Thank you so much, sir.
Thank you, everyone.
Knowledge for us.
And bye.
Bye, sir.
Bye, sir.
Oh, Shaila, madam, unmute.
നന്ദി ഡോക്ടർ അജനി. എല്ലാവർക്കും നമസ്കാരം. ഇന്ന് IFPHന്റെ 1026ാം ദിനമാണ്. ഇന്ന് ഈ പരിപാടിയിൽ പങ്കെടുക്കുന്ന എല്ലാ ബഹുമാന്യരായ ഡോക്ടേഴ്സിനെയും ഹോമിയോപ്പതി സ്നേഹികളെയും സ്റ്റുഡൻസിനെയും നമ്മുടെ വിശിഷ്ട വ്യക്തിയായ ശാന്ത പി ചന്ദ്രൻ ഡോക്ടറെയും എല്ലാവരെയും ഇന്നത്തെ പരിപാടിയിലേക്ക് സ്വാഗതം ചെയ്യുന്നു. പരിപാടി തുടങ്ങുന്നതിന് മുമ്പായി ഒരു നിമിഷം ഈശ്വര പ്രാർത്ഥന. നമുക്കെല്ലാവർക്കും അറിയാം, നമ്മുടെ വിശിഷ്ട അതിഥി നമുക്ക് ഇന്ന് ക്ലാസ് എടുക്കാനായി എത്തുന്നത് ശാന്ത പി ചന്ദ്രൻ ഡോക്ടറാണ്. മാഡത്തിനെ കുറിച്ച് പ്രത്യേകിച്ച് പറയേണ്ട, സ്വാമി ആതിരദാസ് ജി അവാർഡ് കിട്ടിയിട്ടുള്ള വ്യക്തിത്വമാണ്. അതുപോലെ തന്നെ 40 വർഷത്തെ ചികിത്സ അനുഭവമുള്ള വ്യക്തിയാണ്. അതുപോലെ വന്ധ്യതാ ചികിത്സയിൽ 40 വർഷത്തെ ചികിത്സാ അനുഭവവും, അതുപോലെ തന്നെ ഒരുപാട് കാര്യങ്ങൾ നമ്മളോട് പറയുവാനായിട്ടുണ്ട്. മാഡത്തിനെ ഇന്നത്തെ ക്ലാസ്സിലേക്ക് ഞാൻ സ്വാഗതം ചെയ്യുന്നു. മാഡം.
നമസ്കാരം ഡോക്ടർ ഷൈല. താങ്ക് യു ഫോർ യുവർ അഡ്വൈസ്. നല്ല വാക്കുകൾക്ക് നന്ദി. നമ്മുടെ
ചോദ്യോത്തര വേളയാണെന്നാണ് പറഞ്ഞിട്ടുള്ളത്. പക്ഷെ ചോദ്യങ്ങൾ അധികം വന്നിട്ടില്ല. അതുകൊണ്ട് ആദ്യമായി മാഡത്തിന് എന്താണ് ഇന്നത്തേക്ക് നമ്മളോട് പറയുവാൻ കരുതി വെച്ചിരിക്കുന്നത്? ആദ്യം അത് പറഞ്ഞ ശേഷം ചോദ്യോത്തര പരിപാടിയിലേക്ക് പോകാം.
ആദ്യം തന്നെ നമ്മുടെ മാസ്റ്റർക്ക് പ്രണാമം അർപ്പിക്കുന്നു. അതോടൊപ്പം IFPH സാരഥികൾക്ക് ഒരു വലിയ നമസ്കാരം പറയുന്നു.
മാഡം ക്ലാസ് തുടങ്ങുന്നതിനുണ്ട്. ധനേഷ് ഡോക്ടർ എന്തോ പറയാനായി ഹാൻഡ് റൈസ് ചെയ്തിട്ടുണ്ട്.
ശരി,
ധനേഷ് ഡോക്ടറെ.
അല്ല, ഞാൻ ചോദ്യത്തിലോട്ട് ആദ്യം തന്നെ ചോദിക്കാം. അപ്പൊ ഏതായാലും ഇപ്പൊ ഡോക്ടർ ഇൻട്രൊഡക്ഷൻ പറഞ്ഞു കഴിഞ്ഞിട്ട് നമുക്ക് ചോദ്യത്തിലോട്ട് പോകാം. അതായത് ചോദ്യം ഞാൻ ഇപ്പോഴേ പറയാം. ഇൻട്രൊഡക്ഷൻ കഴിഞ്ഞിട്ട് അതിന്റെ ഉത്തരത്തിലോട്ട് വന്നാൽ മതി. അതായത് ഒരു ഹോമിയോപ്പതി ഡോക്ടർ എന്നുള്ള രീതിയിൽ എന്നാണ് ആദ്യമായി ഒരു ഇൻഫെർട്ടിലിറ്റി കേസ് ചികിത്സിക്കാനുള്ള അവസരം ഉണ്ടായത്? അത് എങ്ങനെയാണ് അത് പിന്നെ മുന്നോട്ട് കൊണ്ടുപോയത്?
ആൻസർ പറയട്ടെ.
ആ,
ഒരു ഹോമിയോപ്പതി ഡോക്ടർ എന്നുള്ള രീതിയിൽ ഞാൻ ഫൈനൽ ഇയർ പഠിച്ചുകൊണ്ടിരിക്കുന്നു. ഫൈനൽ ഇയർ എക്സാമിനൊക്കെ മുന്നോടി ഞാൻ ഫ്രീ ആയിട്ട് എൻ്റെ വീടിന്റെ പരിസരത്തുള്ളവർക്കും എൻ്റെ വീടിന്റെ അടുത്തുള്ളവർക്കൊക്കെ ഞാൻ മെഡിസിൻ കൊടുക്കുമായിരുന്നു. അപ്പോൾ എൻ്റെ വീടിന്റെ അടുത്തുള്ളൊരു ആന്റി, അവർക്ക് കല്യാണം കഴിഞ്ഞിട്ട് 14 വർഷമായി, കുട്ടികളൊന്നുമില്ല. ഞാൻ ഫ്രീ ആയിട്ട് മെഡിസിൻ കൊടുക്കുമ്പോൾ അവരുടെ ബ്രദേഴ്സിന്റെ കുട്ടികളെയൊക്കെ എൻ്റെ അടുത്ത് കൊണ്ടുവരുമായിരുന്നു ഇങ്ങനെ മരുന്ന് വാങ്ങിക്കാനായിട്ട്.